I would like to introduce our panelists to the audience. Nihal Terzi, founder of the Health Store Türkiye, and they have a UK office in Manchester as well. Ece Gönen, founder of Klinik Europe in Turkey. Dr. Ertan Erel, consultant plastic surgeon, clinical lead in breast reconstruction, University Hospitals North Midlands in UK. He has also a position in consultant plastic surgeon, head of plastic surgery department in Victoria Hospital in London. Dr. Mehmet Çallıoğlu, founder and CEO of Healing Journey in Turkey, in Antalya. So our panel keynote is the future of medical tourism. You have international medical tourism experience. All the speakers have a great experience, I know. We can compare some region, especially recent medical tourism developments in Europe, including Turkey. So Nihal Terzi, as a founder of the Health Store Türkiye, you have a great experiences in many European countries. Could you please tell us recent developments in Europe and how Turkey adapt their position in medical tourism market?
The history of medical tourism, what I found when I was entering the market was offered to countries where the treatment itself wasn't available in the country, the home country. So people traveled because they couldn't find the treatment they needed elsewhere. And in the recent years, I mean, kind of like American-led, is people started traveling for elective surgeries because the home country, the treatment itself is actually available in the country, but it's too expensive. Because it's too expensive and it's not accessible, people started to travel. So Europe, being part of the EU, was quite advanced, and because if UK didn't have the beds, obviously people get to see. What happened definitely because of the pandemic and the Brexit, if I need to bring it back to the whole UK and where we are and why we're here, is suddenly other countries started emerging, like Turkey. Turkey was doing a lot in the background for over the last 10 years, basically building the infrastructure. Infrastructure meaning the latest technology available in the health sector, the physicians themselves, the doctors and the nurses, and the actual health providers. And the hospitals. The hospital infrastructure is absolutely amazing in Turkey right now, and how they rank against the world. So the shift is now towards Turkey from Britain because we're no longer part of the EU in UK, and even the European countries like Ireland, like Germany, like Austria that I'm working in, still choose Turkey as a destination and choose us as a destination because we are, we are the best medical treatment providers within that 4-hour distance.
Yes, I was going to ask you the following question: what is the advantages for international patients to visit Turkey for medical treatments? You already covered that.
The industry is like a £500 billion industry, but nobody knows where that money goes to because a lot of it is actually operated undocumented. So there are loads of people traveling to Turkey along with lots of other countries for different medical treatments, but there is no documentation to be found unless you speak with the certain governments. But even these governments don't know where basically those treatments taking place. But how Turkey kind of differs from the other leaders in the health tourism, we have basically the functional quality and the technical quality. And the functional quality in Turkey is the treatments and the technology and the infrastructure, and technical quality is the people, basically what people are looking for as service. But Turkey is great we are experienced because we come from a service background of tourism. And the treatments, like they're not being available at home here in UK and or in a long waiting list available in Turkey, and we can plan them and we can actually carry them out to a higher standard. The reduced cost is again a main leader, basically for attracting Turkey for the European and British travellers, and the actual tourism destination. You can have a holiday and have your treatment done at the same time.
Which country NHS authorized when the NHS patient goes to the other country? I think it's Northern Scandinavia.
NHS has different agreements. I mean, basically HSE has agreements with the UK. So if HSE can't afford or don't have the suitability, they can send patients to either UK or other European, like Lithuania, Hungary, Poland is kind of the main destinations, and same goes to NHS. So if basically NHS don't have the availability, very unlikely they will send it to a non-European country, but they send it to the European countries still.
I think the Bupa, as a main insurance company, they start to providing service in Turkey with Acıbadem hospitals.
Yes.
Many more carry on probably in the future. It's going to be very helpful.
This is exactly why we need to start. We need to start these talks and actually introduce other great hospitals in Turkey. So because the Turkish hospitals are kind of like, we have the privately owned private hospitals, and we have the university hospitals that can give you great care, and then we have obviously the government hospitals that takes care of a lot of Turkish people. So we have the infrastructure, we just need to kind of market them correctly and and do the deals, trade deals with UK to accommodate all British patients here.
Plus the travel opportunity for the hot destinations. Dr. Ertan, from the UK perspective, as one of the most prestigious plastic surgeons in NHS, as yourself, can you continue to explain why UK is the most important market for Turkish travel and medical tourism companies? The other way around.
Yes, Turkey has got the great potential for tourism. So we know that, I think before the pandemic, there were 50 million tourists go to Turkey, and quite a lot of British people, they choose Turkey as number one holiday place. They keep going, as mentioned earlier on. And then they had the opportunity to learn about health tourism, and they like to combine it. And especially if the prices are hard price, a lot of people think that, I will try Turkey. And so from my experience over the years, initially there were not many people going to Turkey for treatment, but they found the opportunity and they started going. And a lot of people, I think, from England went to Turkey. The UK population, more than 50% would like to have cosmetic surgery. Yeah. So that's a big number, 55%. And they are looking for it all the time. On top of this, there is also opportunities for other procedures. It's like orthopedic procedures, that long waiter, because the UK system has two-tier system. One of them is the urgent cancer care, which we need to see the patient within 2 weeks, and then we need to finish the treatment within 60 days. So those patients get the priority, and the other ones, they have to wait maybe 4 months to see a doctor. So they might have a pain, but they can't see a doctor in the hospital. And the treatment target is around 1 year. So if they don't get 1 year treatment, hospital gets a bit of fine. So they try to keep patients on the waiting list, and then try to fix them before the deadline. So that's a recent thing.
And some clinical treatments such as stem cells for especially orthopedic issues. So I think the regulation is very tough here, that you can get quick treatments, that Turkey is available for international patients to come and have stem cells.
Yes, Turkey is a big country, and we have lots of doctors. They're very well trained, and some of them are pioneers. And the Turkish regulations can allow some treatments that is difficult to find it in UK. So that's another opportunity.
And also in Europe.
Yes, yes. So we've got great opportunities because there are lots of good doctors. Although I sort of initially trained in Turkey and came here and became a specialist in plastic surgery, I worked in different specialties: orthopedics, general surgery, vascular surgery, casualty. So I worked in different parts, and then I went to Turkey in my sort of fellowship period and worked in Turkish hospitals with top plastic surgeons and ENT surgeons to find out the techniques. So I had a lot of experience, so I know what's happening here and what's happening there. And so this will give us a good opportunity to get more patients going to Turkey.
So the advantage for Turkish medical tourism companies to attract the UK market.
Yes.
Because the destination is close to UK, or it is the UK patients is more valuable patients for them to have an exact demand than other countries, or what is the difference for Turkey medical tourism companies to having the UK patients to Turkey? You get my point?
You ask so many things, so if you just...
Okay, the UK market is basically most important market for Turkish medical tourism companies. I'm asking what is the main purpose for this point?
Well, Turkey is only...
They don't attract more clients, other European destination that they want to, especially UK market, the patient going to Turkey.
I mean, UK, maybe people like, traveling. English people like traveling.
Yeah.
Some countries may have difficult, concept of going to other countries for treatment, but, English people, they like to go if they find the opportunity. So the importance of Turkish companies trying to attract UK citizens is easy in a way, but they have to provide a good service.
Yes. Also, NHS, one of the points, maybe, the waiting time and everything?
Yes, I have been informed about this talks many years ago. Because Turkey wasn't in the EEC, we couldn't have an agreement to transfer and treat patients in Turkey. But now UK is independent, so why not have a sort of serious talks with UK and Turkey? I know that talks were going on for many years, and so infrastructure is probably carried out. I can give you examples of treatments like hip replacement in UK probably cost about £13,000.
It's 6,000.
Probably less than half.
It's 6,000, and also the waiting, unless you're in great big pain, the waiting time at the moment in the UK is 3 to 4 years. And obviously, if you're 60 plus 3 or 4 years, it's a big percentage of your lifetime to waste in pain for a treatment that you can actually avail yourself on £6,000.
In 5 stars hotels?
Yep, everything, every hip replacement. Basically, we can provide that. You know, we just did one last month. The patient was in Turkey for 22 days in total. This includes basically the operation, the travel, literally everything. And you know, him, or based on 2 people as well. So they, including the physio, everything they ever needed. And now she's coming back for knees and, you know, both knees. That is going to be done after the summer when she can have the second lot of anesthesia, but which is a quality of life that she wouldn't have if she didn't make the trip in the first place. The biggest drive for British people to go to Turkey seeking medical you know, treatment is the waiting list. The fact is, the pandemic, before the pandemic, it existed. Now it's, you know, treblefold, because one thing it's became more apparent than it was before is the NHS. NHS can't cope with the current demand in UK. They can't, you know, it can't look after its own citizens in a level that needs to be. Like, you know, like the doctor said, the waiting lists are horrendous, and people want to find a solution immediately, not in 2-3 years down the line. Yeah, like also what was happening before, the UK was sending to other European countries, but because of the pandemic, the Spain struggled, Italy struggled, Poland struggled, every other European country struggled to cope with the whole of the demand of the pandemic. And whereas Turkey, we had enough hospitals. Yes, we may have you know, struggled with the ICU units at some stage, but overall, we were still able to carry out elective surgeries during the pandemic, which didn't happen in the UK. So that's one of the good reasons to travel to Turkey at the moment.
I just want to make a comment. Now the hip operations, most of them are not done in the NHS hospital.
Oh,
so what does NHS hospitals do is contract with the private hospitals. So I also work in a private hospital, and I see the NHS consultant coming and doing the operation there. So the NHS pays it.
And it's probably cheaper.
Yeah. And if they pay this cost in Turkey?
Yes. So that's what, I mean, already NHS is employing the private local hospitals in UK. So why don't you have a contract with England and offer surgery in Turkey, which they should look at it in a positive way. Absolutely. Because the cost will be half price.
I think this discussion needs to be between the country.
Yes.
Governments.
Or the health, Ministry of Health. Did you hear anything that maybe NHS have an action plan for the future health tourism with other countries already? Are they having any discussion in NHS?
I'm not sure about that. Because
that would be really frowned upon between the Brits, because NHS is basically, that's why we pay our taxes to get looked after here. And, you know, in a way that we should do for elective surgery, yes, but there's some things, you know, like you have to have it done, it should be done here. So that would be trying to contract out to another country, which will have to be covered by NHS. They wouldn't let you do it, I don't think. But things can change. Privatisation of NHS is, you know, is a big subject. Everybody tries to avoid.
For plastic surgery market, I think Brazil is good for your UK travelers as well. Brazil is doing well as well, but flying time is far than Turkey.
About 10 hours.
Yeah, the shorter flying time in Turkey would be advantage as well comparing to Brazil.
Yes, I mean, Brazilian plastic surgeons are famous, so they perform operations well. But Turkey Istanbul is, I would say, becoming #1 in the world.
In the near future or far future?
It is in the near future. I will be attending a conference in Istanbul. It's just a rhinoplasty in June, and all the world rhinoplasty surgeons are coming. So lots of conferences happening, lots of education, and the surgeons are very good.
Many successful plastic.
Yes, we have more than 1,000 plastic surgeons in Turkey, and if you look at it here in UK, it's only 300-400. So we haven't got enough plastic surgeons in this country. That's another reason that people travel abroad.
Yes, also more operation practice in Turkey is available for other international doctors. They are going to Turkey to
Yes.
be witness for during the operation to watching the Turkish doctors. Also advantage. So Ece Gönen, you also have great experiences, as I know, in Northern Europe region and also Turkey. Could you please compare quality of medical services in Turkey and the other European countries?
Of course, thank you so much. I'm Ece, and I am the co-founder of Klinik Europe, which was established in Norway 4 years ago and currently carrying out its operation in Antalya. So I had a lot of chance to observe the Norwegian market as well as the UK market and also the Northern European market. So the thing is that we need to think is the healthcare is a process industry. So patients come in, patients go out. So there are many factors contributing to the quality of healthcare, such as the patient's information and rights, accessibility, outcomes, and reach and range of the services provided, basically. But the healthcare costs are becoming a growing burden for the Northern European countries, especially after the COVID pandemic. So this means that the current resource allocation and management methods needs to be readdressed and needs to be agile to adopt new strategies. So as any professional manager from a healthcare-related industry would know that smooth procedures and with a minimum pause or interruption is key to utilize the resources, therefore lowering the costs. But managing a corporation with basically 1,000 hundreds of employees requires top management skills. When we consider the English NHS system, which has over 11.5 million staff, so that would require top management skills. So I'm just not sure if the authorities are handsomely rewarding these managers or putting enough emphasis on hiring such managers. So also in beverage organizations who are responsible both for financing and provision of the healthcare, there would seem to be a risk that the loyalty of politicians and other top management decision makers could shift from being the patient center to the organization. So that would also create another problem on the patient's perspective. I think the poor accessibility of Northern European healthcare must be more or less entirely attributed to the mismanagement. As a lack of resources, I don't think can be the possible source of the problem. So, but on the other hand, Turkey, with its hybrid healthcare management model funded by the government and employers and out-of-pocket payments, succeeds to keep this process flowing without creating any bottlenecks as much as Northern European countries would do. So Turkey seems to be dealing greatly with global medical pain points, such as controlling the infection rates, managing waiting times, increasing the range and reach of services, and plus the agility of Turkish healthcare systems allows it to get continuous feedback from the providers as well as the patients. That contributes a lot for us to improve our service quality and also the safety. So basically we have more time to interact with the patients before the procedure, during the procedure, and after the procedure, and also monthly, bi-monthly, and yearly follow-ups. So that will also create a difference where Turkey stands apart from the competition from other countries, I would say. And also finally, Turkey's unique experience with quality in the tourism and services industry makes the Turkish medical tourism packages very attractive to both tourists and the patients themselves. So I would say that that's why Turkey stands apart from the competition, and also very attractive destination for all sorts of medical treatments for the Northern European market, including the UK market as well.
Do you have any sort of statistic which country has more demand to Turkey hospitals for critical operations?
For critical operations, I would think of also because there is this mental process behind these critical operations. I wouldn't say that emergency cases fly to Turkey from any European countries, but as you mentioned, hip replacement surgeries, knee replacement surgeries, stem cells surgeries, bariatric surgeries, and some elective surgeries from mainly from UK, the Netherlands, Germany, Russia, and Ukraine, I would say. They love Turkey, flying to Turkey, because they know that the service would be great and the quality of medical care would be great. I recently had a chance to speak to a patient of ours, and she was going to come to Turkey for bariatric surgery with a companion, basically. And her concern was her companion would accompany her to the hospital. Like, she said, do you have any beds there? Can he just sit on a sofa? I said, no, we do have beds for your companions and they can accompany you. So she just said, oh, well, that's great. And with NHS, if you are lucky, you get an armchair. So I think that would summarize up the whole process and decision process for them to flying to Turkey.
That could be advantage. Also, satisfaction rate is increasing.
Yes, they are very satisfied with the quality of service and the outcome as well, because as Nihal mentioned, they know what they are getting at the beginning of the process. So as long as you deliver what you promised, so they have this intent to come back for more.
Yes, in UK, conflict point, maybe you aware of this, that when they do statistic from the returning patient from Turkey to UK, based on their satisfaction, they compare the Turkey patients on the UK patients from going to Turkey. They don't compare generally internationally. So obviously the rate is going to be showing the not accurate.
No.
It must be comparing the other
countries. Yes.
Satisfaction.
Yeah, unfortunately, the statistics are not there to report on great, number related. But that has to be governed, and this is one of the reasons why we all are, I guess, demanding more governance on the medical health tourism.
Yes, in Turkey, I think the Minister of Health has a specific department, health tourism, medical tourism department.
Yes, we have. We have. I mean, I know myself. I'm a member of, and I have the right certificates and everything else. But what we're not governing is that the patients that is going with the I call it the black market. It happens, it exists, and it's very much there. And it's probably at the moment about 50 to 60% of the Turkey's health tourism market. We don't know who those people are, and we don't know where they go and where they have the operations, and but obviously mine and Ece's patients, the government knows the numbers and we know how many or what operations we do. So there is only 213 medical health tourism operators, 60 medical health tourism operators in Turkey who are licensed that government knows about, but the rest are just barely Facebook pages.
Yes. I'm going to come back to these licenses and certificate that many companies has in Turkey to compare, and also international certificate authorization later. What are the top 3 medical treatments in Turkey based on the global statistic? Maybe you can answer this. Plastic surgery, rhinoplasty, which are the recent
bariatric surgery, and the hair transplant.
Yeah, hair transplant.
The world stats are bariatric, reconstructive plastic surgeries, and dental, hair, and other being lots of other things like orthopedics and everything else. And I can give you the stats on Turkish ones that we know of, and which is basically bariatric comes first, plastic comes second, and then fertility and sterility, basically IVF treatments comes third in Turkey.
International patients can have the
IVF, yeah.
treatment?
Yeah. It's one of the biggest.
Okay.
I mean, one of the third biggest, yeah.
So, how is the process, Nihal, in your UK branch before you send the patient to abroad?
I was trying to explain this to the professor from the Irish, hospital last week on the radio. When we first set up, we didn't actually have, I've seen a gap in the market, and I thought my history is automotive, so automotive data to be precise. So I'm a very process-driven person. I need things to be written, and I need to see things through as they are written. And so basically the UK part of the business is totally based on understanding of the people's needs and what people expect and what is the most successful outcome. So if the most successful outcome is for them to go to Turkey, have their operation, and cope with the results of the operation afterwards when they return home, then we have to kind of set up the UK business to manage that. Prepare them for their operation, and because these are elective surgeries, and then look after them when they come back. So for the aftercare. So the UK business, what UK business does is prepare them on a understanding of UK British person or an Irish person or a German person, like how they want to be prepared for the surgery, mentally, physically, if it's bariatric surgery, diets before, and mentally if you're going to be able to cope with the surgery expectations, and what is going to even just down to the pain. You would think people go for plastic surgery, oh my God, it hurts. Seriously, you'd think you were going to have a breast reconstruction and didn't think it was going to hurt. And there is a different perception to all of this elective surgery. So our job as a health tourism provider's job is prepare them before they arrive in Turkey and look after them when they come home.
Ertan, in UK, based on your patients, what are their priority question about medical tourism if they prefer to go to Turkey? What type of question they're asking? Are they asking about safety questions or just quality operation or doctor perspective?
Their main issue is the cost. So, they say how much. And then, obviously, they want to know there's a good surgeon, so they like to see the befores and after photographs, and then also maybe check with another person who has been through that journey and follow them. So, but the main thing is the cost.
In your private hospital you work, when it comes to price during the conversation, so if they think it's expensive to have the operation here, so are they asking you, because you are a Turkish doctor as well, do you suggest any good doctor in Turkey or good hospital in Turkey, and do they ask you certain following questions regarding the cost and etc.?
Well, usually the patients find it themselves rather than asking me, can I go to Turkey? Because they have other sort of links, so social media became very popular. But some of my patients, they come in for different surgery and they say, oh, they've been to Turkey and they have this such and so experience, or they're going to Turkey for this procedure, and always the cost comes the first. so they can't afford it. So I think that's the main thing. But obviously they need to be informed about the journey and aftercare. So aftercare, about 15 years ago, I attended a plastic surgery conference in London here, and they were talking about what are the weaknesses of health tourism. And aftercare comes number one, because some companies, it's like the black market or whatever, they take the money and then there's no contact with the patient. And if there is a problem here, who's going to deal with it?
Yes. Do you have collaboration with hospitals in Turkey? They send their patient to you for that?
No, I haven't got links with them, but some patients come to me, or some surgeons ask me to see their patients.
I mean, I'd love to kind of say that our aftercare, I mean, for my bariatric aftercare, I think I can rival with any UK business or any Irish business at the moment, because, you know, we are actually supporting their patients as well, because NHS or HSE, it's not that accessible. You see your surgeon once and that's it, and you have a conversation with your dietitian before surgery and after surgery on just 2 or 3 times on a private. If it's NHS, forget about it. You can never access them because of the pandemic. Nothing is accessible at the moment. So I do a lot of support work to NHS and also private work on the bariatric side of the things, because it's not just about, like the doctor said, it's not just about the surgery. Surgery is just 3.5 hours, for a breast, surgery, or for bariatric surgery, it's an hour of the process of the journey, but the journey before and after is the main key.
Actually, all packages are very important. So, Dr. Mehmet.
Hello.
Hello.
Hello, everyone. I am Dr. Mehmet Çallıoğlu from Antalya, Healing Journey Medical Excellence Tourism Company.
I'm so jealous you come from very hot destination.
Yes, our company is based on in Antalya, which is the one of the most beautiful cities in the world. Yes, I am lucky. I know.
Yes.
Okay, and first of all, I want to thank you to organizer of this event in this amazing atmosphere, to Yalçın Avcı and Haluk Özsevim. And I want to thank you them for they give chance to speak about medical tourism here. Yes. And I am so excited. I took some notes. I look my iPad. From now, I apologize, everyone.
No, it's okay. I also read from my.
Okay.
Okay. Let's talk about as you are a Turkish medical practitioner doctor and providing a health tourism services to international patients in your Healing Journey company, which is based in Antalya, as you say, it's one of the most touristic destinations in the world. Could you please explain what are the advantages for international patients to go to Antalya for medical treatments?
As Antalya is one of the most important holiday capitals of the world, it has hosts a high number of patients in medical tourism and provides great satisfaction. As a radiologist, I have been directly involved in the diagnosis, treatment, and follow-up processes of patients in many fields of medicine. Thanks to this, we are able to follow the treatment process of the patient from the first moment with the eyes of the doctor. As the doctors and healthcare professionals on our staff, we stand by our patients at every stage of their recovery journey with the principle of primum non nocere, first do no harm. We don't forget the patient's relative on this healing journey. We have specially prepared free dental and medical checkup package for our patients' relatives. Antalya, a 5,000-year-old settlement, has been home to numerous civilizations. Antalya, one of the most beautiful cities in the world, as I said before, and an open-air museum await them, as do city and cultural tours and a variety of activities that will make them happy. With its unique nature, 4 seasons of sun, beautiful sea, hospital equipped with high technology, and experienced doctors, Antalya is at the top of the world's medical tourism centers, I think.
Do you think Istanbul is the best or Antalya is the best?
I think Antalya is the best.
I think
Because
I'll argue Izmir in there just to kind of
Okay. So, how do you provide therapies and treatments and spending time in Antalya to your patients?
I answer that question you ask.
Yeah. So,
Yours.
when they land to Antalya airport, you take
Yeah.
good care of them and also the full package of
I talk
the,
about
the
yes.
hospitals and everything. Yeah. So why, from your perspective, why Turkey is the most important medical tourism destination for the UK?
Turkey is a country with international successful physicians who have medical deontology and professional ethics, devoted experiences and knowledgeable physicians and health centers equipped with high technology. Turkey, with its centuries-old medical history and culture, has a health system where all kinds of treatment are successfully performed at world standards. Everyone can easily reach specialist doctors. There is almost no waiting time in any treatment. And follow-up, and diagnosis, treatment, and follow-up process work flawlessly. Turkey is also a natural healing location for people in every sense, with its weather, nature, and 4 seasons of sun. Antalya is one of these cities in Turkey. Turkey is one of the leading countries in the world with many hospitals, specialist doctors, nurses, intensive care units, and many others. With its reasonable price, high quality, and high success rates in Turkey, especially in dental treatments, bariatric surgery, plastic surgery, and especially in eye treatments, it is the first choice for people living not only in UK but also in many countries of the world. Turkey also has a strategic geographical location that attracts approximately 1 billion people and 57 countries within a 4-hour flight distance. Turkey is considered the most ideal region for health tourism due to its ease of transportation and flying to most destinations in the world with a national airline brand like Turkish Airlines. People who prefer our country for treatment can combine their treatment with a wonderful holiday in luxury hotels, its unique touristic place, and cultural attractions. Because of it, I think Turkey will be one of the top countries in medical tourism in next years.
Next year?
Yeah, next years. In next years. A few years later.
So, based on the recent medical tourism developments, I would like to contribute to explain the JCI accreditation for the hospitals. So, around the world, Joint Commission International Organization, JCI, reports in 2018, and there are 1,041 hospitals approved by JCI accreditation in global hospitals. So 46 health institutions in Turkey and 29 of them in Istanbul. This is really good numbers. And Turkey has a high number of accredited institutions in the world, which is located in top 3 in the rankings.
Is it the top 3 or 4? I think. Yeah.
It's 2018. Yeah. Was in top 3.
Yeah.
So when patients search hospitals in Turkey, it would be difficult for them to compare better quality medical services. But if patient can contact medical tourism companies like yourself, each of you, that you can. They can get the best advice for the listed hospitals who has the JCI certification and who has better practitioner doctors in this field. So it's really important to contact medical tourism companies in person. And also they need to be aware of that in 2017, Ministry of Health Department brings some regulations to the market about medical tourism. They are given to medical tourism companies health tourism certificate, international health tourism certificate. So that means they are also caring of the international patients for the safety reasons, for any aftercare situation or any insurance problem. They take care of their situation as well as the medical tourism companies.
One of the things, the newest changes they made, that's why I kind of congratulate the Turkish government building the infrastructure. Now the infrastructure is built, is how we market the industries, becomes more important, and also how we regulate it becomes more important than anything else. And one of the newest changes to it is they are now forbidding the hospitals work with unlicensed medical tourism operators. So before, anybody could actually refer patients to a doctor, refer patients to a hospital. Now, not only you have to have a health tourism license, you actually need to be both basically both the doctor and the medical health tourism agency has to have the license.
And so, tourism companies.
Yes, the tourism clusters. Yeah. So it's actually going into the right direction. It's how we actually manage and regulate. Is
so
the
it seems the Turkey government preparing themselves to
absolutely
have
100%
this real tough discussion with other countries.
Absolutely.
UK maybe in the future they say we are ready. Are you? Okay. Ece, maybe you can tell us what was the procedure for you to apply for the health tourism, international health tourism certificate with the government. So is it a tough process, long process, or?
Basically, when you have an intention on your mind, like you want to provide the best service at affordable prices with quality of outcomes, so you have that on your mind and you are settled to do whatever it takes. So you start with applying for the health certificate and medical tourism certificate, and it requires a few establishments, like in terms of corporate establishment. You have to have a call center, and you have to have your departments, you have to have your legit agreements with your providers, basically with the hospitals, with the doctors, so everything is under control and they are recorded. So when you are ready, for me it took like around 8 months to get it for my company, but it was during this process we had current improvements. Basically, we learned the things we didn't know before. We were learning on the job, basically hands-on learning. So that helped me a lot with my company to take a leap of faith, trusting the government with its implementations and requirements. And when I look back from where I was just 1.5 years ago as a company, so it improved my service quality and my communication with the foreign patients, and also my perspective viewing the medical environment as well as from my eyes and Northern European countries, patients' eyes, basically. Yeah.
Can I add some things about that? Why patients ask to companies if they have this license or not? To improve quality and set standards in health tourism, Turkey's Ministry of Health issues health tourism authorization certification to organizations that meet all of the requirements. The Ministry monitors institutions that provide health tourism intermediary service regularly and has imposed several penalties on those that do not have certificate of authorization. Organizations with a certificate of authority are in charge of all of transportation, lodging, transfer, treatment and follow-up processes for people who come to Turkey for treatment. We advise all of our incoming patients in Turkey to question the documents of the center where they will be treated, as well as the companies that will mediate the treatment. Patients need to prefer institutions with authorization certificates to find an official address at any stage of the treatment process that may be encountered. Having interpreters with experience in health tourism, speaking in the person's mother tongue, are always with the patient during the treatment process. professionally solving any situation that the patient may encounter in accommodation, transfer, or daily life outside the treatment process, and having a corporate company that can be reached 24 hours in a day in case of a problem. It's one of the reasons why they prefer their establishments and agencies. When any complications, doctor said, every operation has sometimes complications, every time it can be. When any complications inherent in surgical procedures occur, the treatment process must be carried out by authorized institutions for these complications to be covered by insurance. Complication insurance policies are based on the principle that the patient's flight, accommodation, and retreatment expenses are covered by the insurance under certain conditions when there is a need to be reoperate in the complication arising from the treatment or surgery process of patients coming from abroad for treatment or surgery. These insurance policies are only valid through a hospital with the authority given by the health ministry to perform health tourism. I think this is the most important point. If they want insurance and if a problem is they see
facing,
yeah,
so
facing,
they need to be treated
yeah,
by
in this policy in all surgical procedures. Complications written in the information and consent form signed by the patient before the operation are covered, all of them. This is very important to British people.
It's very good developments on
Yes.
the safety side, actually.
I would like to make a comment. Over many years, I've been living in UK, so I see that patients go and have a complication and come back, and nobody looks after them.
It's very important.
Yes. The GPs don't want to know because they had surgery. It could be a simple wound breakdown. So they had a tummy tuck and the wound open. So who's going to dress this wound? And or they may have a hematoma, is a blood collection. So if they go to a private surgeons, they don't want to know because it's somebody else's problem. So this is a big issue that needs to be addressed.
We make this insurance to our all patients, dental patients, hair transplant patients, because we think this is a medical.
Yes, but the insurance policy should have the cover in UK as well. So the patient that you dealt with had a problem, but doesn't want to go back to Turkey.
Maybe UK.
So you need
UK
to have,
Minister of Health think about that.
No. Before you transfer the patient to Turkey, you can find an insurance policy valid for a month. Post-operative complication
in
can
England,
cost you in England can cost you £300 or something like that, and offer that to the patient.
It's a good idea.
Bupa started doing with Acıbadem, and in UK also Bupa is the most biggest provider of insurance.
So that will solve more problems because
that's educating the patient, also being able to provide the aftercare in the UK. It's all well and good, and all of us have the medical tourism license, and we have the doctors have insurance, and the hospitals have insurance in Turkey. But that means if there is a medical emergency, NHS is the only go-to place in UK, or HSE is the only go-to place in Ireland for us. In Germany, we're good because there is lots of private, health sector exists, but in UK and Ireland, we are mostly reliant on the national service, free service. We have. After the recent, basically we have a public, as a Health Store Türkiye, because we are a UK business as well as a Turkish business. I have two separate businesses and both of them insured, and I also insure my patients in here as well. So if there was any medical complication, that I can look after them with my public liability insurance. So that is a very well, covered, or if it's a case of it's not a non-urgent treatment that needs, my patients are totally free to come back and have their, re-surgeries, retreatments, revisions, whatever, basically, that they're not happy with, they can come back, have the corrective surgeries. And absolutely, that's built in my, in our, customer contracts that they sign in UK before they go to Turkey. And then when they arrive to Turkey, they sign another contract to say they're happy with the hospital, the surgeon, everything else. So they're insured there as well. You can't ever be too careful when it's medical.
I invited international contracts director actually to join our panel, but obviously the Easter, just the next day after the Easter break, so everybody has busy schedule. But promise, for the next Imagine Türkiye, we will have an insurance company to discuss more deeply about it.
It's a definite must, because at the moment there is only one insurance company from UK will provide a medical health tourism insurance for treatments, but when you read the small print, it's not worth the paper it's actually written on. So it's totally useless. So so we need a medical health insurance provider in UK and Ireland that we can actually purchase the policies on behalf of the patients.
I think it's like a touristic insurance only.
Yes, yeah, sure.
But in Turkey, it's only for complications, and it's for fine 1 year after complication. And maybe it's more cheaper than if there is a complication happen, the patient turn back to Turkey.
It's at the moment
free,
it's cheaper.
Accommodation free, and there is no waiting time. Maybe there is a small complication, but he or she must wait here to.
The problem is, it's like a wound healing can take 6 months in some patients. I looked after one Turkish health tourism patient. She's a relative of my nurse. Nobody wanted to know her in the department, but they came to me and they said, "Oh, you're a nice doctor." I looked after her for 2 months. So dressed her and debrided her wound, and I got it healed. But I've seen her every week. So you need something to sort it out in that aspect, because the feedbacks are very important. Social media, some patients are, yes, good, they're getting cheap treatment, but some other ones, they may not be happy with it, and they write a bad report or a feedback. Then you start losing a lot of customers because of that.
Because of it, we advise.
It's conflict for any sector, not just medical.
Because of it, we advise.
Always look in the negative side. They don't look at the positive.
We advise all the people who want to come Turkey, of touristic or health tourism. They must ask their certificates, and they can search about the company.
So you provide your certificate on your website.
Yeah.
Obviously, they can just simply look at the website. If the medical tourism company agency has this certificate, they can.
And also the government.uk has a list of companies who has a medical license.
Yes.
So
Okay, thank you very much for taking part of this valuable session. The time was short, but my colleague came here.
thank you.
Thank you so much. So we will be following your social media, each of your companies, to get more information about your services.
Follow us. Healing journey.
Hope to see you in another session in medical tourism here or Turkey. Thank you so much.
Thank you for having us.
Thank you very much for our future of medical tourism, and again, thank you for our great speakers and shared loads of information and knowledges about medical tourism, insurance, treatments, and what kind of processes starts with the journey. Thank you very much again.